Hello, it's Dr. Rhonda Johnson. Today is Thursday, February 10th, 2022, and today I'm going to be talking about one more tool we have to prevent COVID infection. Well, folks, since early 2020, scientists had documented that the SARS-CoV-2 virus, that virus that causes COVID-19, can be detected in the urine and stool of infected people. So today I'm discussing stool, also known as feces, and speaking plainly, poop. So did you know that almost half of infected people with COVID shed the virus through their stool? And this includes the Omicron variant, because the virus actively replicates in the gastrointestinal tract. And once in the gut, there's a lot of interaction between the virus, other bacteria, and other living organisms and pathogens of the gut. And this also involves very complicated immunologic and inflammatory processes. It's very complicated stuff, and there's a lot of research that's beyond the scope of this message to look at those interactions. But the bottom line is you can shed live COVID virus in the stool for weeks after symptomatic infection has resolved. And this has led to many communities now testing wastewater for COVID-19. Wastewater can detect virus 1 to 2 weeks sometimes before cases start showing up in a community. Wastewater testing can tell if the viral levels are rising or falling, and they can do genetic sequencing to determine which variants are circulating. Many health departments, many universities and governments regularly monitor wastewater now. Now, I know you may be wondering, can people transmit the virus to others through their stool? Well, folks, if there's surface contamination and poor hand hygiene, that's a theoretical possibility. But in actuality, most cases aren't transmitted that way. They're transmitted through airborne or droplet transmission. But one thing I do want you to remember is that the virus can become airborne through toilet flushing. And once it's airborne, it can remain viable for hours. So, one of our primary prevention methods to prevent COVID infection remains good hygiene. So keep washing those hands, keep cleaning the toilets, keep washing those toilet flush handles, bathroom faucets, and if possible, keep the lid down when flushing after a bowel movement to minimize the virus becoming aerosolized in the air. And folks, even when mask mandates are lifted for indoor public places, you may want to wear a mask when you use a public restroom, and don't forget to wash your hands. That's my message today. As always, my views are my own. Stay safe.